Intentionality, being intentional in your marketing. As I travel around the country and talk with independent community pharmacists just like you, I ask them about their marketing strategies. Their answers will somewhat surprise you. They're always stretched so thin, working so hard, and never enough time in the day. They're focusing on their patient care issues over here, their employee and HR issues over there. Marketing is always the last thing on the list. Sometimes it just doesn't get done, and sometimes what does get done isn't done right. Gone are the days where the independent community pharmacist can bank on just being the known entity in the community. Like the doctor, the lawyer, the dentist. People just looked in the yellow pages and found their pharmacy and went there. There are over 62,000 pharmacies in America today. There's pharmacies in mass merchants, in grocery stores, and probably soon in your dollar store. If there's not a community pharmacy near you, there soon will be. So what are you doing to market your pharmacy? How are you making yourself different? Today, we're going to talk about all these things as we learn to rethink pharmacy. So how do you find your best patient? How do you attract the best patient you can into your pharmacy? You know, corporations spend millions of dollars and put dozens of people on task force to do just that, to find their best customer. So what are you doing as a small business owner, independent community pharmacist to triangulate and find that best patient? As I travel around the country and talk with many of you, that's not being done, and I think that you should think about how you do that. How do you find your best patient, and then how do you attract that patient over and over and over again into your pharmacy? How do you go out into the community and do the same thing and find the patients that you don't have that are the ideal ones for you? Is the ideal patient the mom with 4 kids that are coming in, occasionally for antibiotics? Is the ideal patient the elderly patient that's on Medicare that you know by name? I would argue here that the ideal patient for you is the chronic patient, the patient that has a disease or two that can never be cured, no matter how many times you dispense medications to them. The CDC says that over 50% of Americans today have chronic disease, and that of the healthcare spend in America, over 80% of the dollars spent on healthcare are spent on chronic patients. So why isn't that your focus of your marketing and of the programs and services that you're trying to build within your pharmacy? I'd like to suggest today that they are ideal patients for you, and that you need to take the time to develop programs and services for those patients. The diabetes patient spends 7 times the average patient in the pharmacy today. Yet when they get the diagnosis from their doctor and a prescription, they're given very little information on what it means to them and how it'll impact their lifestyle. So what are you doing when you get a new script from a diabetes patient, and how are you treating them differently when they come in the pharmacy? Many of the studies that we're working on today are showing that the COPD patient is actually more lucrative than the diabetes patient. What are you doing today in the areas of smoking cessation and trying to work with the COPD patient on their disease? These are just a few examples of ways that you can build services to attract the ideal patient into your pharmacy versus just letting patients come in, and being more intentional in your marketing efforts to attract that best patient. Okay, so now we've talked about identifying that dream patient. Now let's talk a little bit about how you go find them within the 4 walls of your pharmacy, or how you go find them within your community. Certainly you can use your pharmacy management system to run reports that identify patients by NDC or by drugs dispensed. I highly recommend that you're actively doing that with your staff. Identify those diabetes patients. Offer services for them to make them feel comfortable within your pharmacy. Use marketing material within the pharmacy promoting the services that you have specifically for that unique type of patient. In addition to using your pharmacy management system, there's also third-party services like Prescribe Wellness and Mavisi, where you can run reports a little easier, have that real time on your desktop, and identify patients by disease state, rank them by dollar spend within your pharmacy. I encourage you to take advantage of the data that's available to you. Justin talked about the ability to use technology to improve your pharmacy practice in another of the Rethink Pharmacy series. I encourage you to listen to his presentation and take advantage of some of the opportunities that are available to you today in the technology space to identify your ideal patient. Now, outside of the ones you already have, the more important part of this is how do you go get the ones that you don't have? Your community is full of patients that have chronic disease that are going to other pharmacies. What can you do to identify those patients? Well, what are you doing today in terms of offering services outside of your four walls? Build the services within your pharmacy and then promote those services out to the community. Connect with your doc, connect with the nurses and caregivers in your community. Go to health fairs. You need to build the services first and then go tell your story to those caregivers and let them know that you'll take care of their patients better, you'll take care of their patients different. And all together, we can rethink pharmacy. As I entered this cute little community bookstore, I started to think about how do they differentiate themselves against the big box bookstores like Barnes & Noble. Certainly no different than independent community pharmacy, and how you guys need to market yourself differently and differentiate your story from the big box chains of CVS, Walgreens, and Walmart. As I travel around the country and talk with independent community pharmacists just like you, I ask them those questions. How do you differentiate your pharmacy amongst all this competition? I get a lot of similar responses: community presence, personalized care, and customer service. Certainly, those are great attributes for an independent pharmacy and one that you should continue to promote. But know that the big box stores are aggressively attacking independent pharmacy in those areas. You've got the Laura's CVS commercials. I'm sure you've seen them, where Laura is standing out in front of the CVS and talking about the great personalized service that they have. And the big Laura's CVS sign drops right down on top of the pharmacy, trying to say that CVS has great personalized care. I'm sure you've heard of the Walgreens commercials, where Walgreens is talking about being at the corner of happy and whatever. And what's their point? I think they're trying to say that they have a community presence, that their corner Walgreens are entrenched in the community when they've just arrived. So they're going to continue to attack us in areas where independent community pharmacies have strengths. In 2012, the numbers came out and Walgreens was spending $36,000 per location on advertising. And CVS wasn't that much far behind. So they're going to use their ad budgets to continue to attack community pharmacy in ways that they are succeeding. So what are you going to do? How are you going to be intentional in your marketing go forward? You need to create new differentiators for your pharmacy, just like this bookstore is creating differentiators for it. Your value proposition must change and get beyond customer service, personalized care, and community presence. It's not to say that you don't continue to work those angles, but you need to have something new. You need to rethink your value proposition to your consumers and to your community. Be intentional in your marketing efforts. James Brown. Now here's a guy who knew how to be different. Sure, he was an award-winning singer and songwriter, but he took his craft to a different level by applying creativity to it, just like you need to do when you rethink pharmacy. Let me tell you a story about a pharmacy in Maine. A 3-store independent pharmacy owner asked me to come to his locations and tell me what was going well and what needed to be worked on. See, he had a primary location that was doing great business, but his 2 other locations were just struggling, and he couldn't put his finger on it as to why. Well, it didn't take me long to figure it out. I walked into the main store, and the staff there greeted me with smiles and said, "How are you, and what can I do with you today? How may I help you?" And they walked me through the store and coached me through all the different opportunities and really made me feel welcome. I then went to the 2 satellite locations and spent nearly 30 minutes in each location, walking the aisles, buying product. Not one person came and said, "May I help you?" or "Why are you milling throughout this store for such a long period of time?" So it just goes to show you, as you build your marketing strategy around rethinking pharmacy marketing, you need to think about all the little things. It's not just the marquee out front of your store, and it's not just your advertisement in the newspaper. It's the little things, like welcoming customers into your store, how you answer the phone, and how you thank them for their business. It's little things like that that will really make an impact on your brand and your consumers. Think about those things as you rethink your pharmacy marketing. Hey, we talked a little earlier about getting out into your community and being intentional about your marketing. And one of the ways we can do that, I frankly just call it bragging, is to talk about some of the consumer and customer satisfaction surveys that are in our marketplace today that I don't feel independent pharmacy does an adequate enough job of promoting and bragging to your own consumers. One of those is in 2014, Consumer Reports produced a study where they surveyed 33,000 consumers, asking them questions around customer satisfaction in the pharmacy setting. And you won't be surprised to know that independent pharmacy and Health Mart independent pharmacies were on top of that particular satisfaction study. So get out there and tell your patients, tell your consumers about the success that you and other independents have had in the world of customer satisfaction. The other study that's produced every year, and from a name that is kind of synonymous with customer satisfaction studies, is J.D. Power. And J.D. Power in 2014 surveyed about 14,000 consumers and asked them questions around the success of pharmacy relative to customer satisfaction and some of the metrics that are used there. Again, not surprisingly, independents and Good Neighbor Pharmacy independents were ranked number 1 across many of the key criteria there. Okay, so now that you know who your target audience is and you've crafted your messages and you want to get those out, I think there's 3 main areas or vehicles that you should use to get your story out. In a 2014 AARP study, over 50% of seniors ages 65 plus are online 2 to 3 times a week. So if you think your seniors aren't looking for you and your pharmacy online, you're mistaken, and you need to build a pharmacy website that's patient-friendly. In that same study, 70% of folks ages 50 to 65 are online 2 to 3 times a week. So it's a target-rich environment for you, and I encourage you to build a pharmacy website to attract those consumers. Vehicle that we should talk about today is social media. And I know you guys just all started to cringe because I mentioned social media, but I really do think it's a great marketing vehicle for independent community pharmacists to take advantage of. By its very nature, social media just brings out the best of community, and it's one of our strong points as independent community pharmacists. So I encourage you to take advantage of that. It's one of the advantages you have over the big box stores is that you're deep rooted in the community and you can take advantage of your community presence through social media. There's been a recent study where almost 50% of consumers said that they don't use social media to conduct business. So they're not going to look on your site for specials or pricing of products. So I'd steer clear of opportunities there and stick to where it could be social in nature. And if you think your target market is not actively pursuing Facebook and other social sources, you're wrong. In an AARP study from 2014, over 35% of seniors aged 65 plus use social media 2 to 3 times a week. And in that same study, over 50% of folks aged 50 to 65 are using social media 2 to 3 times a week. So great stats to show that social media isn't just for the kids or the 20-somethings, that your consumers are using it. Assign somebody from your staff to be the point person for your pharmacy on all your social media. And whether it's a Facebook page or a Twitter handle, I'm not going to suggest which type of social media you should use, but just know that it's a great opportunity to get connected with your community and start to rethink pharmacy marketing. A third area or third vehicle that I think independent community pharmacies should focus on in terms of rethinking marketing is email. And sending out emails is a great opportunity for independent community pharmacies. It doesn't cost a lot of money, and it's something that you can implement in your pharmacy starting tomorrow. Work with your staff, change the operational procedures at checkout or at check-in, and capture those patient emails as they come in. I think a simple opt-in paperwork and asking them if they'd like to hear from their pharmacy about specials and information related to their health, and you're going to get very few opt-outs or folks that say no thank you. Capture those emails and then use that to either focus on a unique group of patients, maybe it's your diabetes patients that you want to communicate with on a separate topic, or just do group emails to your patient database. And don't think that those emails are just clutter and that your consumers aren't reading them. In a 2013 Miller-Brown digital study, it showed that fewer than 8% of consumers never look through their emails and never click through to a retailer's website. So over 92% of consumers are either sometimes or always clicking through to look at specials and or buy from a retailer's website. So take advantage of email marketing. It's there for you as an independent community pharmacy, and start to rethink the way you market. Hey, we've given you some great ideas here on the ways you can message to your consumers and also vehicles that you can use to get those messages out into your community. But the key takeaway here for you all as independent community pharmacy owners is to be intentional with your marketing, to be deliberate, to aggressively craft the messages that you want and get those messages out into the community. That is what's going to be the key to your success relative to marketing. That intentionality or desire to get those messages to your community is what's going to make you successful, and I applaud your efforts.